Hey everyone, my name's Chloe and I'm one of the physios here at Vector Health. And at the end of 2019, I completed my honours bachelor degree in physiotherapy at CQ Uni. And the honours degree entailed that I completed a research task, which my group and I did it with wheelchair users and looking at the effects of sports versus non-sports participants in the factors of shoulder pain and self-efficacy. Alright, so when you first come to see us at physiotherapy, we firstly do an initial assessment. So this initial assessment, we do like kind of an interview with the person and the physio. So we sit down and we talk a little bit about what your presenting problem is. So you might come in with pain, headaches, sore feet, or having problems with your sporting training. So we go through heaps of questions at the start because we want to find out what you are and why you are having this problem. And we go through and we ask your past medical history, we can ask about your social history, we ask about your medications, and we ask lots and lots and lots of questions around your presenting problem. And also in the initial assessment, we make a plan from there of what our goals are, what you want to get as a patient and what you want from us as the physio, and then we work out a plan with the patient and ourselves, and which is very attainable for you. And then after we gather all this information, we look at the problem very holistically. We see what can be causing the problem and how can we go about treating it. Now with that first initial assessment, we do lots of functional and physical assessments as well. So we have the interview and then we have the physical assessment. And this is where we get you to do lots of functional movements, and with the physio we do lots of hands-on testing, trying to again find what is causing the problem that you have there. So first we've done the interview, then we've done the physical assessment, and thirdly we do a treatment, which might be hands-on, it might be technique modification, it might be exercise prescription, which we'll go through in practice. So all of these different things, we try and help you to either minimise your pain or decrease the dysfunction that you came in with. So that first initial assessment is a very round and whole look on the person and the presenting problem, and then we go on to another review appointment, and that's where we really dig deep and get into that underlying issue. When you walk into the facility, you'll be greeted with my smiley face and I also love to just get to know my patients. I want you to just come into my office and sit down and just like we're having a coffee dates and chats. I'd like to get to know you, you like to get me, and I like to keep it really casual. And when you're on the plinth of our bed, when I'm working on you, I love to have a good conversation. So you can come in and you can talk to me about your kids, your grandkids, your plants, your pets, anything, and I'd love to have a good chat. And I always find that some of this talking and getting to know each other just de-stresses a little bit, relaxes, and we can actually get a really good treatment out of that session as well. Here at Vector, I've been seeing and treating a wide variety of clients. I see pediatrics, so little babies, all the way up to the elderly as well, for many different reasons, many different conditions, many different dysfunctions, and I really enjoy that. And you'll see me treating these clients either in this beautiful big rooms that we have here or out in the gym. And I love being in the gym because you can get people really enthused and encouraged to participate in their treatment. And with a 15-year background in gymnastics, I like to bring some of those principles and training techniques into my treatment here and as a physio, which is really good fun for those little kids who like to run around in the gym. And after recently becoming a first-time mum, I now have this new appreciation for pediatric and baby growth. I love watching them every day and seeing how they grow. And as a physio, I'd love to facilitate hitting those milestones for those little bubbas and babies. And after being pregnant and being in that postnatal period, I also have a new appreciation for the woman's body and how it can function and train as well in both stages of antenatal and postnatal, which is an area and aspect of physiotherapy which I really, really do love. I love helping these mothers train very safe and appropriately, either in the gym or out outdoors or going for a walk, and also I love treating these people if they do have any pains as well or dysfunction. And I love spending my weekends at the beach, going on coffee dates and just catching up with friends and being very social, which you'll get to learn that about me, and I'd love to get to know about you guys too. See you at Vector.